I want to talk about the subject of presenting treatment to patients, or basically sales. Okay, how do you sell a person, a patient, about the need for whatever service you're recommending? So it falls in the area of communication, and it has three components to it that determine whether you're successful in conveying to the patient or to the customer what should be done. And in this video, I just want to talk about the first one. And the first one is that the patient needs to understand what the heck you're talking about. We tend to have big words that we think, because we use them so much, that we think they're, everybody should understand them. We have our own jargon. We have our own way of explaining stuff because we learned it and we've done it, and we've used those words for the last whatever years you've been in practice. So we think that everybody else should understand them, but that's not the case. So you could be telling somebody that they need XYZ, but they have no idea what XYZ is. And because most people are polite and they don't want to make you feel bad, they just, shake their head and, thank you for the information, kind of a thing. But in reality, they really didn't understand what you were saying. So they don't understand the words that you're using. So extremely important to use small words. What I mean by that is don't use the jargon, don't use the terminology that we've been taught in dental school and that we use as professionals. Use words that people understand. Examples, and I'm gonna be really, really, really low here on the gradient of words, but an example would be using the term bacteria or germs. Most people, I would argue, understand germs. Germs are bad things. Okay? They're things that cause issues in your body, and you probably should do something to get rid of them, or at least to counteract whatever effect they're causing you. Instead of using bacteria, which is what people, also they've heard of it, but a lot of people, bacteria, what is that? Viruses, bacteria, it's a big word, okay? So you could, in a sentence, you could say, hey, Mrs. Jones, there are some germs underneath the gum, and those germs need to be removed for you to have a healthy situation. As opposed to, hey, Mrs. Jones, there's some bacteria causing infection in the gingival tissue that needs to be taken care of. You basically said the same thing, but the first one, most people would understand easily. The second one, a few people would understand. But because, again, as I mentioned earlier, people are polite, they would shake their head, but they have no idea what you just said. Okay, and that affects what they do later on in terms of their decision, whether they actually accept whatever treatment you're recommending, or to say, you know what, let me think about it. Let me talk to my husband or wife. I'm a little busy, so I'll call you whenever I can. And all the rejection things that we all have heard. Anybody who's been in practice for a while has heard all of them. So that's the number one rule. Always use words that you feel people should understand, and always make sure that people understand them by asking them, hey, Mr. Jones, does that make sense? Is it understandable? That kind of stuff. And this way you're prompting them to say, you know what, I'm not sure I understood this, or can you repeat that? And then that you may, you probably are using words that they didn't understand and that you need to change your sentence. So, number one, thank you very much. I'll talk to you later.